High cholesterol levels are always a problem for those who want to take or control hyperlipidemia. Many medications and supplements are out there, but what we eat is the most important and fundamental for treating and preventing dyslipidemia. Food intake lowers cholesterol levels in various ways. Let's find out good food promoting healthy life. Since the 8th century in the Tang Dynasty in China, red yeast rice began to be used to lower cholesterol. Red yeast produced monocholine K, which is now known as lovastatin, the medicine that lowers LDL cholesterol in the blood. Monocholine K is the principal active substance. The mechanism is through a competitive inhibition of the HMG-CoA reductase, which is a key enzyme in the cholesterol synthesis. So, red yeast rice has exactly the same mechanism to lower cholesterol as lovastatin does. It is much easier to take red yeast rice than the drug because of its low content of pharmaceutical compound. Its metabolism in the liver is the same as rovastatin. Watch out your liver. Taking red yeast rice with an antioxidant supplement might be a good option to prevent any liver damages. If you take any cholesterol lowering medicine, red yeast rice will disturb your treatment. So, ask your doctor or pharmacist before intake. Like most statin drug, it might have side effects on the liver and muscles. In addition to lowering blood lipid level, monocholine K also prevents colon cancer, acute myeloid leukemia, and neurological disorders such as Parkinson's disease and type 1 neurofibromatosis. Soybean. Clinical studies indicate that the consumption of soybean protein might reduce cholesterol and LDL levels, preventing the development of atherosclerotic cardiovascular disease. Consumption of soybean protein may reduce cholesterol and LDL levels. The main content of soy protein are the two globulins, beta-conglycine and glycine. They are 90% of the total protein of the soybean. After absorption and transport to the liver, soybean protein could modulate the homeostasis of cholesterol. These proteins block LDL cholesterol production, leading to healthy blood conditions. Phytosterols, plant-originated sterols or stenols, inhibit cholesterol absorption. A cup of soybean contains about 300 mg of phytosterols. Phytosterols are components of plant cell membranes. It functions like cholesterol in animal cell. Cholesterol and phytosterol structure are remarkably similar, and this makes that happen. There are cytosterol, campasterol, and stigmasterol, which the only structural differences are side chains. Western consume about 2 to 300 mg of phytosterols per day. An Asian and vegetarian diet consume higher. Higher amount 1 to 3 gram a day make a difference in decreasing LDL cholesterol level. Meta-analyses have constantly shown that 1 to 3 gram a day of phytosterol or stenol esters lower plasma LDL cholesterol concentration up to 15% compared to placebo. Many explanations exist for the mechanism of phytosterols. A possible reason is that phytosterols make cholesterol soluble and easy to eliminate from the body. Green tea, catechins, a family of polyphenols, are powerful to deal with total cholesterol. There are many clinical trials on green tea. A double-blind, randomized, placebo-controlled study on green tea polyphenols. This study indicates that green tea polyphenol treatment could have potentially beneficial effect on LDL cholesterol concentrations. Another study of green tea demonstrates a constant trend of decreased total cholesterol, reaching 5.3%, and decreased LDL plasma levels. Dietary polyphenols have received much attention in the prevention of cardiovascular disease due to their potential LDL cholesterol lowering effects. Fatty fish. Omega-3 in fish oil always give us the right answers. Omega-3 does lots of things, including control triglyceride synthesis through inhibiting diacylglycerol acetyltransferase 2 and its metabolism through beta oxidation. It especially reduces triglyceride in the blood. However, depending on the individual, omega-3 can lower triglyceride, but LDL level can be increased. Increased LDL level by omega-3 does not affect blood vessels, so no need to be concerned. And also, omega-3 protects blood vessels and the heart with anti-inflammatory effect. Eating fish 2 to 3 times a week can manage blood cholesterol levels. Whole grains. Fiber in oat, barley, and beans are rich. Soluble fiber helps to reduce the lipid absorption rate in the gut. They bind cholesterol and its precursor in the digestive system and drag them out of the body before they get into circulation. And they also make you feel full just after a meal. It is very helpful to lose weight. Thank you for watching my videos. Omega-3 supplements are easily accessible to lower triglyceride. But how about LDL cholesterol? Food in this video are mainly focused on improving LDL levels in the blood. Why don't you try these healthy dietary to get good blood condition?